Hi everyone, I'm Namita Jain, a wellness specialist and a wellness author. I am at Bombay Hospital in Mumbai and I'm delighted to be in conversation with Dr. Anil Sharma, a leading cardiologist. Doctor, the subject that I would really like to discuss with you is hypertension. I think a lot of people are having hypertension, and it is known as a silent killer. So, before we go into further questions, could you just say briefly what is hypertension and why is it a silent killer?
Very important question, Dr. Namita.
Yeah.
Hypertension is described as common silent killer. Why common? Means every third adult is suffering from this disease. It is the commonest reason for anybody going to the physician. In India, out of the 140 crores, 60 crores are adult and 20 crore are suffering from hypertension. And second thing is silent because more than 90% people do not have any symptoms. And
Yes.
if it is neglected, it can be killer. It affects brain, eyes, heart, kidney. That is very, very important thing. And you would surprise that only 10% people blood pressure is adequately controlled.
Thank you so much, Doctor. I think this is such a vital information for the viewers. Doctor, in terms of exercise and hypertension, a lot of people are very, very obsessed or interested in building their bodies. A lot of exercise enthusiasts and bodybuilders with hypertension go to the gym and lift heavy weights for building a body. Is this okay? I mean, does the body adapt? I mean, is it all right for a person to do this, or should they exercise with caution? What is your advice?
Very important question. First, you understand what are the different kinds of exercise. What we call is a endurance exercise means aerobic exercise or isotonic exercise where there is a movement like swimming, walking, running, jogging, anywhere there is a movement, it is like a aerobic exercise. Second is the stretching, which is more common in the yogas. And third is about the isometric exercise that is against the resistance in those who are hypertensive, those whose hearts are weak, isometric can be disastrous. So those who do not have hypertension, they can do isometric to the certain extent. Even in some cases, they can go for the isometric exercise, like particularly like those who are in the wrestlers, those who require like heavy weight lifters, they require big muscles. But
Yes.
normally calling isotonic exercise and stretching are good, and isometric exercise should be done with the caution in a limited amount.
So, doctor, stress. Okay, stress can increase hypertension. Even exercise goers, they have certain objectives and goals, and therefore, in while exercising, they also have that goal in mind. Do you think that can increase the blood pressure being stressed?
Very great question, Dr. Namita. The first understand what is stress. Stress is the difference between expectations and performance. So if you do some performance and expect more, then stress comes. So best way to take care of the stress is about the meditation and relaxation. It has been proved in various studies that people were advised to go for relaxation and reduce the blood pressure. Stress can cause the blood pressure, high blood pressure, hypertension, and hypertension can lead to the increased stress. So it is a vicious cycle. So de-stressing is very, very important for those who are suffering from the hypertension.
Thank you so much, doctor. I think this information is so useful for a hypertensive patient who is also a regular exerciser. Is there a final takeaway message you would like to give to the viewers before we sign off this video?
The most important thing nowadays we see about the various dietary products. So first thing is diet should be balanced. It should contain protein, fat, and carbohydrate in a various mixture. About the various additional things like creatinine which we are taking. This creatinine is up to certain extent may be taken. It is neither recommended nor it is banned. Those who require very aggressive short-term exercises like weightlifting where we require big mass, this creatine can help, but it can cause dehydration, because it increases, it brings the more water to the muscle, so it can cause dehydration, it can cause cramp, it can damage kidney, it can cause blood pressure. So those who are with hypertension, they should avoid it. Those who do not have hypertension and they want sprinter type of the exercises, they can do it in the limited amount, but otherwise those who are for walking, running, jogging, endurance exercise, it is not beneficial. So these people should avoid. Everybody thinks that if it or he takes the creatine based this diets, his or her muscle will be good and it will be in shape. That is not recommended.
Thank you so much, doctor. This is so useful for every exerciser. Thank you for your time and this interaction.
Thank you.